Okay, I took my NCLEX Iron test, and then guess what? I passed. Oh my god. Yeah. Okay, I have to start for now. This was my third try, and then my first try I did the like UWorld and then Mark Clinics. I failed. Second try I did Remar and Kaplan, again failed. So this time around I did NCLEX webinar, and then I followed A to Z. Whatever Mo said, I did that. I did like not only twice, I repeated like 3 times, 4 times, and then I even did like 20 rituals yesterday, and then today I took my test, and after that when I came home I found the pop-up. Then I sent it to Joe. Oh my god, Joe, I cannot thank you. Like, thank you is not a like not enough. I don't know how much I have so much respect for you. I have so much whenever I text you, you responded like every time, even midnight, like anytime. I have goosebumps right now. Oh my god, I cannot believe I passed. Oh my god, I cried. Um, I don't know. Like, I took like 4.5 hours to do like 75 questions. Like, can you believe that? Like, first time around, when I did like 90 questions, I did in 2 hours. Second time 150 questions, 2.5 hours. This time 75 questions and then 4.5 hours. Like, whatever Mo said, like I literally took like one question 10 minutes or more than 5 minutes, but I wanted to pass because whatever Joe said, like yes, last time when he said like think that this is your like life, this is life depends on like this depends on your life. I don't know what I said. Okay, I'm so happy. Thank you so much. Oh my god, thank you. Thank you, Joe. Everyone, you should like everybody should follow Mo's webinar. This is the best thing. Like, I'm never going to like forget my whole life. Like, before leaving to my NCLEX, I literally did this to Joe Mo. And then I left. Oh my god, thank you so much. Bye.
Hey, welcome back. See what is the common theme that you hear among students who passed before? Listen, your story is not unique, and if you are a first-time test taker, oh my god, I'm so happy for you because you found me early in the process. And you don't have to go through those feelings of, when you fail, you get devastated, you get depressed, you get emotionally unstable, you feel that you are stuck, you get ashamed from, telling your friends that you failed or your family. You feel that like you didn't meet the expectation, right? You're supposed to be the hero in the eyes of your own family, but now you're not. But listen, I've got an amazing quote by the end of the session, which is gonna reboot your brain. And now we're gonna talk ABGs. A lot of people love ABGs, and I'm gonna move to the whiteboard and explain a few stuff after we see the next question. The nurse provides care for a patient with acute anxiety. What is the most important for the nurse to assess the patient for? And you've got 4 options: respiratory alkalosis, respiratory acidosis, metabolic alkalosis, and metabolic acidosis. You notice that I didn't read the question again, I didn't pick up keywords, and I didn't rephrase the question. Why? This question is blunt. Like, whenever you see such questions about ABGs, you literally know there are few things that they're gonna ask about ABGs. Once you master ABGs, literally you put a smile on your face, just like delegation and prioritization. You put a smile on your face once you get those type of questions because it's just simple math, okay? So if I want to rephrase this question, I've got a patient, he's acutely ill, he's having anxiety. So usually the gases in the body, they shift in a certain way. And I'm gonna teach you that. So what's the right option? I don't want you to guess. I'm gonna give you the answer, and then I'm gonna move to the whiteboard and explain ABGs. Okay, so the right answer is respiratory alkalosis. Anxiety causes hyperventilation, which results in a loss of carbon dioxide. Respiratory alkalosis is caused by decreased carbon dioxide in the blood. All right, arterial blood gases, let's move to the whiteboard. All right, let's set the cameras there. All right, listen. we're gonna explain ABGs in literally 5 minutes. Some people take like 30 minutes, an hour, maybe a whole day to explain ABGs. Listen, I'm not gonna do that for you. 5 minutes and you're gonna retain the information forever. Simple algorithm where you use tic-tac-toe method and it works like magic. So there are things you need to know, like normal values, compensated, partially compensated, fully compensated. I'm gonna explain all that, don't worry about it. First we're gonna start with what matters in an ABGs. You've got a pH, PCO2, and HCO3. That's all you need to know for your NCLEX. Normal values. I'm gonna put right here a scale. Here it is alkalotic. And here it is acidotic. So pH, the normal value for pH is from 7.35 to 7.45. So if it's on that side, it's alkalotic. If it's on this side, it's acidotic. Simple math. Normal value for PCO2, so it's from 45 to 35. You see, I flipped them. The only reason I flipped them is because PCO2, if it's more than 45, it means acidotic. If it's less than 35, it means alkalotic. So just to keep that scale, I flipped the PCO2. And the normal value for HCO3 is 22 to 26. Listen, now that we have mastered the normal values, which is simple, you need to memorize them, I want to explain a pH. pH is the buffering system in the blood. You've got CO2, it represents the lungs, respiratory. So anytime PCO2 is abnormal, we're talking about respiratory. And then you've got HCO3. Anytime we are talking about abnormal HCO3, I want you to think metabolic, I want you to think kidneys, okay? So listen, buffering system in the blood, you've got respiratory, which is the lungs, carbon dioxide, and then you've got metabolic, which is kidneys and other organs, right? Simple math. Now I'm gonna give you an example about ABGs and then we're gonna break it down and analyze it. All right, so as I said, we're gonna use the tic-tac-toe method. First here, I'm gonna write acidosis. Here is normal, and here is alkalosis. All right, so this is the example that I'm gonna do. pH equals 7.27. PCO2 equal 48. And let's say HCO3 equal 29. All right, so I hope you can see right there. So now I'm gonna put those in this table. So pH 7.27, is it normal, is it acidotic, or is it alkalotic? Since it is below 7.35, then it is acidotic. I'm gonna put it here, so I'm gonna put pH right here. And then you've got PCO2, it's 48. Where's 48? Oh, 48 is on this side. So 48 goes here, so it's in the acidotic. I'm gonna put PCO2. Then I've got HCO3, which is 29. Where's 29? Oh, 29 goes right there. So I'm gonna put 29 on the alkalotic side. So I'm gonna put HCO3 right here. Now, if I wanna analyze this question, what would I say? This is a tic-tac-toe. Usually, tic-tac-toe is vertical. You don't go diagonal, it's just vertical. So you've got acidosis, pH, CO2, this is a tic-tac-toe. So it is respiratory, because PCO2, and then acidosis. So it is respiratory acidosis. It's that simple. Now, I've got the HCO3, it's on the alkalotic side. If HCO3 is on the alkalotic side, I would say partially compensated. So this example is partially compensated respiratory acidosis. Why is it partially compensated? Because the HCO3, which is the kidneys, they are not normal. They're doing something. So they're trying to compensate. So that's why it's called partially compensated. Now, if HCO3 was on this side, I would say, so if HCO3 was at the normal side, I would say uncompensated respiratory acidosis. Why? Because the kidneys are chilling. They're normal. They're not doing anything about it. So if the HCO3 is normal, I would say uncompensated respiratory acidosis. See how simple is that? Now I'm going to give you another example. Let me erase the table. So I'm going to erase this. I'm going to draw it again. I'm going to keep the normal values. Real quick, I'm gonna give you another example. And let's say pH equals 7.42, 27, and 19. And let's say this is PCO3 and HCO3. Okay? Now, I'm gonna draw my tic-tac-toe board. I'm gonna write normal here, alkalosis. I should have gotten a new marker. And I've got acidosis right here. Alright? Let me put those right. So now, the pH is 7.42. Where does it go? Where does it go? Oh, it's in the middle. So it's normal. I'm going to put pH here. So pH is normal. Now I've got PCO3. It's 27. Oh my God, Mo. PCO3 is 27. Oh, it goes right there. 27. Man. It's under alkalosis. So I'm going to put PCO3 right here. 27. And that HCO3 is 19. Mo, where does it go? Oh, right here. Yes, man, of course. This is 19. So it's under acidosis. So I'm going to put HCO3 right here. So listen, do I have a tic-tac-toe? I don't. What do I do in this case? Listen, I'm going to show you. What do we do? This is what you do. If both are abnormal, so now you don't know where the problem is. Is it respiratory or is it metabolic? How do you know? You want to look for which one is more abnormal. Which one is more abnormal? So now I'm going to look at the numbers. I've got here 27. The normal is 35. So 35 minus 27 gives me 8 points, right? So 8 points. But if I want to check the HCO3, the HCO3 is 19, and the nearest normal is 22. So 22 minus 19, it's 3 points. So now, which one is more abnormal? So obviously 8 points is more abnormal, which means that the main problem is in the lungs, because the CO2 is more abnormal. So this is what I would say. I would say respiratory alkalosis. So respiratory alkalosis. Now, you look at the pH. The pH is normal, right? So if the buffering system in the body is normal, that means it is fully compensated, right? So it is fully compensated respiratory alkalosis. So now, I explained uncompensated ABGs, partially compensated ABGs, and fully compensated ABGs. And listen, if you didn't get the hang of it, all you have to do is rewind 5 minutes back and rewatch it again, and make sure you take notes, put them in your My Notes, okay? So that's it. Don't worry, I'm gonna give you plenty of examples about ABGs during this course, and we're gonna practice, and I'm gonna test your knowledge. But that's all you need to know about ABGs. Now, let's get back. I'm gonna get back to my desk, and let's talk more about ABGs. All right. I hope ABGs is now crystal clear. Listen, if you need to go back and watch the video again, just that ABGs part, please do it. I mean, you watch it a couple of times and then it will stick in your head forever. Again, repetition is key to success, and that's how you retain information, is with repetition and practice, okay? One more slide about ABGs, which I want you to know, which will summarize everything you need to know for the NCLEX about ABGs, and those are the causes of ABGs. So metabolic acidosis is caused by shock, DKA, drug poisoning. So anytime you have metabolic acidosis, you're gonna think of 3 disorders and 3 disorders only: shock, DKA, and drug poisoning, okay? Respiratory acidosis is caused in COPD and asthma. Respiratory alkalosis, which was our case in the previous question, is caused by panic attacks. Patient is hyperventilating. CO2 is washed out. You ask your patient to breathe slowly, and sometimes you give them a paper bag to breathe in it. That way you can help them retain CO2 and lower their anxiety or their panic attack. And lastly, you've got metabolic alkalosis, and those are caused by vomiting, hypovolemia, diuretic use, gastrointestinal suctioning, and hypokalemia. All right, listen, I've got one more ABGs question for you, and let's see if you can guess it this time, okay? Let's see. A patient who had a gastric surgery 2 days ago has an NG tube attached to intermittent suction. The patient had a large amount of secretions in the last day down in the suction bottle. Which ABG result will the nurse expect to see? Hey, listen, you should know this. We just discussed it in the previous slide when we talked about the causes of ABG's interpretation, right? The causes of ABG's disturbances. So, remember, suctioning on an NG tube for a long period of time or too much suctioning, what does it cause? Remember that? Yeah, no? Think about it once, twice. Yeah, it's metabolic alkalosis, right? Metabolic alkalosis. Now, in the options, it doesn't say metabolic alkalosis. So, I need to guess which one of those are or is metabolic alkalosis. So let's guess together. When I say metabolic, that means HCO3, right? So the first two options have PCO2 in them. I'm gonna cancel those because those are respiratory. They are not metabolic. So I'm gonna keep number 3 and 4 because they have HCO3. So HCO3 in 3 and 4. Now I'm looking for metabolic alkalosis. So alkalosis is pH higher than 3.45. So which option is right? Of course it's number 3 because the pH is 7.49, which is alkalosis more than 7.45. So the right answer is number 3. This ABGs results in reflective of metabolic alkalosis, which is the right answer. I hope by now you mastered ABGs, and if you didn't, that's fine. I don't expect you to. So go back, watch the whole thing again, maybe 10, 15 minutes, maybe 20 minutes. Just watch the whole thing again, and you will love it, because that's all you need to know about ABGs when it comes to the NCLEX. You are a master. Trust me, you got this. All right.
Hey, are you enjoying this training so far? I hope you are. If you are, please click that heart and let me know that you are enjoying it. Maybe hit me up on Instagram. I would love to hear what you have to say about this. But listen, before we move on with episode 4, I would like to ask you a quick question just to make sure that you are retaining information. Which of the following is accompanied by metabolic alkalosis? I've got a panic attack, I've got hypokalemia, I've got asthma, and I've got drug poisoning. What do you think is the right answer? Yes, you are right. Hypokalemia is accompanied with metabolic alkalosis. I mean, when you look at panic attack and asthma, those are respiratory. And then you've got drug poisoning, it is metabolic acidosis. But hypokalemia is metabolic alkalosis, so you got the right answer. I'm glad that you understood ABGs. Love your face, and let's continue with the episode. Let's go.
A patient states, I feel ugly because I lost my hair after receiving chemotherapy for ovarian cancer. Which statement does the nurse say to help the patient cope with those feelings? Listen, I have empathy for oncology patients. I mean, my heart and soul goes to oncology patients, especially pediatric oncology. But, I mean, in this case, if I want to read the question again and pick up keywords, everything is talking about feelings. So let's read it again and pick up keywords. A patient states, I feel ugly because I lost my hair. Listen, feelings, very important. So feel is a keyword. After receiving chemotherapy for ovarian cancer. So chemotherapy. So why she feels ugly? Because she received chemotherapy, lost her hair. So chemotherapy is a keyword. Which statement does the nurse say to help the patient cope with those feelings? Cope. Cope is a keyword. Again, the nurse is going to say something that's going to help the patient feel better because she's feeling ugly after losing her hair. So the nurse needs to say something that's going to help the patient's feeling or help the patient feel better and compensate for losing the hair. Okay? So let's read the options. Number 1, let's see how you, did you notice that we rephrased the question in our own words without even intentionally going back to the question and rephrasing it? Habits. Second nature. I want you to build those habits. So do it enough times until it becomes your second nature. Let's read option number 1. Let's see how you look with a shawl or hat. Number 2. Your hair will grow back in 3 to 4 months after you finish treatment. Number 3. Some women shave their heads when this starts to happen. Number four, number three is hilarious. Number four, just think how it makes you not brush your hair every day. Listen, number four is hilarious as well. You cannot talk to patients like that. I mean, number two, that will just exaggerate the problem. So, saying to the patient or telling the patient, hey, some women or some ladies shave their head. Are you asking the patient to shave her head? She already feels ugly. Now you want to make her bald? Shaving her head does not help. I mean, the nurse saying that to the patient does not help with their feelings. You want something immediate. Like you want to say something that will immediately make her feel better about herself, right? So definitely number three is not the right thing. And then when it comes to number four, this option looks a little bit sarcastic. Even if it is true, and the nurse is trying to say something positive about the patient's hair loss, saying that the loss of hair reduces work is not supportive of the patient's feelings and does not help with her body image. So I would cancel 3 and 4 right off the bat. That leaves me with number 1 and number 2. Let's see number 2. Your hair will grow back 3 to 4 months after you finish treatment, which is totally true, but that does not help the patient right away. It does not address the feelings right away. That's like a long-term information that the patient can use. But right away, if I give the patient a hat or a shawl, she can put it on and she can feel pretty. She can feel that she has some style or fashion, and that will resolve any feelings that she has about losing her hair, like feeling ugly. Okay, so the best option is number 1. Let's read the rationale together. The patient has feelings of a disturbed body image and low self-esteem because of hair loss. The nurse needs to say something to improve those feelings. Suggesting a scarf or hat is appropriate. It will offer an immediate solution to the patient. And that's what I wanted to say. Option number 2, that the hair will grow back in 3 or 4 months, which is absolutely right. The patient will thank you for this piece of information, and it will give her relief over the long term. Because you don't want the patient to think after chemotherapy she lost her hair forever. But this question is addressing feelings right now. She's feeling ugly. So we want something immediate. That's why we went with option number 1. Now, I would like to talk about some side effects of chemotherapy. So let's move and talk about some side effects for chemotherapy, because they are very, very, very important. You don't need to know side effects for every specific drug, like side effects for etoposide or vincristine or cisplatin. You don't need that for your NCLEX unless you're working in an oncology department. But for the NCLEX, you need to know side effects for chemotherapy in general, and we're gonna go over them in the next slide. So side effects for chemotherapy. Let's start with nausea and vomiting. Some side effects start even before the patient gets into the cancer center to get their treatment. And that's what happens with nausea and vomiting. It's anticipatory. You know what I mean. So nausea and vomiting, sometimes those side effects are anticipatory. So they happen before the patient comes into the cancer center to receive treatment. That's why you treat them. So you tell the patient to get like Ativan or lorazepam way before, or maybe Zofran or ondansetron before they come to the cancer center, like an hour before or 30 minutes before, so that when they come to the cancer center and see that huge sign cancer center, they don't feel nauseous or they don't vomit, okay? So the second side effect is fatigue. Very, very, very popular. Mouth sore or mucositis. And let me tell you a little thing about mucositis. Sometimes when you see it, or not sometimes, all the time, when it's visible for the nurse and you see it inside the patient's mouth, it's already too late. Because the oral mucositis actually starts down in the stomach. Those sores in the mucosa starts down in the stomach, all the way up in the esophagus, and then they show in the oral mucosa, buccal area, and the tongue, the gums. And that's when it's like too late, because the patient is already not eating, they're having pain, and then you treat those side effects. But oral mucosa, I just want you to know that it starts with the stomach, and by the time it's visible, it went all the way to the esophagus, and then to the laryngeal area, pharyngeal area, and then buccal area, the tongue, the gums, and then you can see it. It's like white patches, okay? Number 4, nerve damage or neuropathy. 5, neutropenia and infections. And when we say neutropenia, and this is the importance of medical terminology on this course, you need to know medical terminology. And I don't care what's your English level. It could be 2 out of 10. It doesn't matter. But if you know medical terminology, you can pass your NCLEX flawlessly. Listen, I've got students from the Middle East, from India, from Brazil, that their English is literally 2 out of 10. And they still pass their NCLEX because they mastered medical terminology, okay? So the most important is to understand what the examiner wants to tell you in that question. So neutropenia is low neutrophils, and neutrophils are responsible to fight infection in your immune system. So it's part of the white blood cells. You've got neutrophils, basophils, eosinophils, and all those kind of cells. They are white blood cells to fight infection. But in particular, neutrophils, they cause neutropenia, and that's when you look for, in oncology, you look for the ANC, which is the acute neutrophil count. So if the ANC is below 1,000, that patient needs to be on reverse isolation. And we'll talk about isolation later, but that's a guideline when you need to put this patient in a private room because you don't want them to be exposed or at risk to get an infection during their hospital stay. So neutrophils, neutropenia, and infections. So the next one is diarrhea and constipation, then hair loss or alopecia. Alopecia means hair loss, and then 8, amnesia. You've got changes in appetite and or weight. 10, lymphedema, which is a very, very, very painful swelling, and you see it with mastectomy patients with breast cancer, that they remove their breast. It's called mastectomy surgery. And then the hand near the operative side will have lymphedema and swelling. It's very painful. And if you don't know what's the lymphatic system, you can do a quick Google image search. But the lymphatic system is, the vascular system. With every vein, there's a lymphatic vessel that, runs parallel to it. And the lymphatic system, it removes all the waste, fight infection, and throw it out of the body, okay? So do we have number 11? So number 11 is rash or dry skin. And then the nursing care and the patient teaching for patients who are receiving chemotherapy and having those side effects is number 1, dietary changes. Especially fatty food and greasy food, like try to tell your patients to stay away from them. I mean, they will stay away from them because they will make them feel heavy, nauseous, and maybe they will cause vomiting. Just a quick tip, a quick piece of information, side effects of chemotherapy usually start to appear 7 to 10 days after administration of chemotherapy. And it's called the nadir phase. It's N-A-D-I-R, nadir phase. And that's 7 to 10 days after administration of chemotherapy. You will see the bulk of side effects from chemotherapy. So dietary changes. Number 2, simple exercise such as walking or yoga. Number 3, you're gonna give them medication for those side effects. So you're gonna give antiemetics for nausea and vomiting. You're gonna give painkillers for pain. Usually with pain medication or painkillers, you would want to give them around the clock to minimize the discomfort that the patient is having, depending on their pain threshold. And then you've got neuroleptics for neuropathy symptoms. Some chemotherapy medication, they cause peripheral nerve damage, like vincristine, vinblastine. You don't need to know that, but vincristine and vinblastine, they cause something called peripheral neuralgia, where the nerve endings are damaged, and that will make the patient feel numbness and maybe burning sensation in the extremities. Whenever they touch cold, they feel like a lightning or something. So you give neuroleptics like Neurontin. So also you've got mouthwash and antifungal for oral mucositis, and of course lastly you've got diuretics. A very good resource for you and your patients to know more about oncology and chemotherapy and side effects and everything that has to do with cancer is cancercare.org. So I'd highly recommend that you check it out, just see how it works in case you want to check something for your relatives, for your patients, for yourself, doesn't matter. So cancercare.org, you will love it. I mean, we literally use that in the hospital and the cancer center. Okay, so this question we're gonna talk about burns, and after the question we're gonna have slides discussing everything you need to know about burns, because literally you're gonna get 1 to 2 questions about burns on your NCLEX. So the nurse provides care for a patient with facial and neck burns. What is the best position for the patient? So we're gonna read the question again and pick up keywords. Are you bored yet? You should not be bored. This should be an amazing game for you. So every time you see an NCLEX question, you're gonna read it the first time, and the second time, we're gonna play the keyword game, okay? So let's read it again and find the keywords. The nurse provides care for a patient with facial and neck nerves. Facial and neck nerves is one of the keywords. What is the best position for the patient? Again, what the question is asking, they're asking about the best position for a patient. Patient was in a burn accident or in a fire accident, whatever the case might be. They had facial and neck burns. So I can visualize the patient, facial neck burns. So what is the best position to put that patient in? Is it on his face, on the side of the face, put a pillow behind his neck? So let's read the option, but you can already imagine when we say what's the best position, you already imagine, hey, where should I put this patient? Should I put it on the side, prone, supine, semi-fallow? You know, so you start guessing before you read the options. But let's go ahead and read the options and try to figure out what is the best position for this patient. Number one, prone with a roll sheet under the head. So I'm gonna put a roll sheet under the head, and it's prone, like literally prone. I mean, I'm not even gonna consider reading this option again. I'm gonna cancel it because just imagine if a patient has like a burn on his face, am I going to put him prone? No. Right? So prone, I'm gonna cancel the first one and moving to the second option. Option number two, supine with padding on the affected side. So let's say the face is burned from this side, so I'm gonna put a pillow on this side or maybe like a sheet to support this side. What do you think? Like if there's a burn, you want to stick something to it? Number three, supine without pillows or padding. Four, prone without extra padding around the head. Listen, so I already eliminated number one and two. If I look at number four, I'm gonna eliminate it as well. I mean, if a patient has facial, like we're talking facial burns, I'm not gonna put them prone. That's literally very uncomfortable. So I'm gonna cancel four. The right answer is supine without pillows or padding. Let's read the rationale. A supine position minimizes pressure and irritation to the burned areas. But burned areas may stick to pillows or padding. That's why we don't even put paddings or pillows under the head of the patient, under the neck, or anywhere beside the burns. Pillows may cause contractures in patients with neck burns. All right, now we're gonna move to the next slide and talk about first degree burns, second degree burns, third degree burns, and everything that has to do with burns. So first we're gonna discuss the severity of first degree burns. So it is a superficial partial thickness, and you wanna imagine it like a sunburn. That's the first degree burn. It's just like a sunburn. Superficial partial thickness. Number two, injury to the epidermis. So if you know the layers of the skin, you've got the epidermis, dermis, you've got the subcutaneous tissue, and then underneath it, you've got the muscle, the fascia, and the bone, right? Fascia, muscle, and the bone. So those are the layers, and according to the severity, it shows how many layers are burned, you know, first degree, second degree, and third degree. So with the first degree, it's just the epidermis, just like a sunburn. Leaves the skin pink or red, but no blisters. It is dry, it's very painful, slight edema, and no scarring. It will leave the patient with no scarring, not even a bit. It's just like a sunburn, okay? So second degree burn, so it's deep partial thickness, destruction of the epidermis and dermis. It's painful, which is relieved by cooling, appears red or white, it has blisters and leaks fluid, it's very edematous, blanching followed by capillary refills. So when I press on it, it gets white, it blanches, and then it gets to the regular color or the burnt color. Heals without surgical intervention and does not have scar. And that's very important to know. First degree and second degree burn